Part 1: When Care Becomes the Cause. She said it casually, almost like a weather report. I have arthritis everywhere. My hips, my back, my neck. It's just who I am now. No tears, no drama, just a settled conclusion. Her chart said physical therapy for mechanical diagnosis and treatment. And in that single line lived the story of how modern care can quietly become the cause. When most people hear the word iatrogenic, they think of surgical complications, medication side effects, or infections acquired in hospitals. But there is another form of iatrogenics that rarely shows up in statistics. It doesn't bleed, it doesn't scar, it doesn't trigger a lawsuit. It lives in meaning. It happens when a scan is misread as destiny, a label becomes an identity, a warning becomes a life sentence, and no one ever charts it as an adverse event. The day her pain became mechanical. Years ago, someone likely pointed to an image and said a version of this: see, this is wear and tear, your spine is degenerating, this is just arthritis. None of those statements are technically wrong, but they are incomplete in the most dangerous way. What her nervous system may have actually learned was, my body is deteriorating, movement is risky, pain means damage, I must protect myself at all costs. And so protection became the posture of her life. Structural findings, existential consequences. We know this now. People with no pain at all routinely show disc bulges, joint degeneration, arthritis, abnormal MRIs. And yet we continue to behave as if structure is verdict. The result? We don't just inform patients about their bodies, we install a story into their nervous system. And the nervous system believes stories faster than it believes statistics. Language that leaves a mark. No scalpel, no prescription, just words. Bone on bone, degenerative, your spine is crumbling. There's nothing left to do but manage it. These phrases don't injure tissue, they injure identity. They teach the brain to predict danger in every movement. They flatten possibility before healing even begins. This is iatrogenics without fingerprints. Identity is the longest lasting side effect. At some point, pain stops being something a person has and starts becoming something they are. I have a bad back. I'm broken. I'm falling apart. And once identity fuses with diagnosis, the nervous system defends the diagnosis, even against recovery, especially against recovery. The unintended curriculum of modern care. No one sets out to teach fear, but the system quietly trains it through over-imaging, certainty without context, a mechanical model applied to learning systems, and a culture that equates pain with damage. We teach patients something powerful long before we ever teach them how pain actually works. And it's not resilience. A different ethical question. We often ask, is this treatment effective? But in chronic pain, a more penetrating question is, what meaning does this treatment install into the patient's nervous system? Because meaning changes biology, not metaphorically, literally. The most dangerous word is just. It's just arthritis. It's just wear and tear. It's just your age. Just is a closing word. It ends curiosity. It ends agency. And healing rarely survives where curiosity is closed. Toward a regenerative frame. Pain, especially long-standing pain, is not simply the echo of damaged parts. It is a system that has learned what to fear, what to predict, and what to protect against. And learning systems don't respond to mechanical instructions. They respond to new evidence of safety. They respond to new stories, new experiences, new meanings, and new movement without catastrophe. They respond when the body is no longer treated like a failing machine and starts being approached as an adaptive intelligence trying to keep someone alive. The quiet responsibility. What if the harm in chronic pain care is not caused by cruelty, but by certainty delivered without humility, by explanations that are too mechanical, too tidy, too satisfying, and wrong in the ways that matter most? The tragedy is not that people receive a diagnosis. The tragedy is that so many people are taught they are nothing more than their diagnosis. And the deepest form of healing may not be correcting tissues at all, but correcting a wrong story the nervous system has been made to believe, quietly, for years, without anyone ever calling it harm.